My name is Sean Aiken. I'm a veterinary surgeon at the Veterinary Specialty Hospital. And controlled activity is a very important part of your pet's recovery from a TPLO surgery. Prior to your pet coming home, you want to make sure you have an area that you can keep your pet confined that is well padded, has good footing, but is going to prevent them from running, jumping, and playing and having access to stairs. If your dog is crate trained, using a large crate to keep them confined is a very good idea. But if your dog is not crate trained, sometimes putting them in a crate, they can actually expend more energy trying to get out of a crate and injure themselves than they would if they were confined to a small room. When your pet comes home from the hospital, they're most likely not going to be using the operated limb. So it's important to flex and extend their limb and keep range of motion. You also want to make sure that when they first come home and they're not using that limb, take them out just to urinate and defecate, because you don't want to put too much stress on the opposite unoperated limb. Passive range of motion consists of flexing and extending the leg through a full range of motion. You want to make sure that they're not painful during this time, so you start this right after you give them their pain medication, but you want to make sure you try slowly and getting them through a full range of motion. After surgery, you're going to see some swelling that's going to occur right around the surgery site, which may gravitate down toward the ankle. So it's very important to massage starting at the foot and working up to the leg and massaging that area to help move fluid out of the lower limb. Initially, for the first 48 hours, you're going to want to ice pack that, and that can be done with frozen peas, an ice pack wrapped in a towel. After 48 hours, you want to hot pack that area. As you're massaging or after you're massaging, that will also help mobilize fluid from the area. Once your pet starts to use the operated limb, you can begin short leash walks for 5 minutes 3 times a day. As long as they're using that limb better and it improves, then you can increase those leash walks in both frequency and duration. But there should be no access to stairs, no running, jumping, playing, and they must be on a leash at all times. Starting about 4 weeks after surgery, it's very important to try to start getting range of motion in the knee. And we do that by doing what are called sit-stay exercises. And so Punch is being very good about that. What we do is we encourage them to sit with a square foot. So when we sit, say, Punch, sit, what we want to do is make sure that their foot gets underneath their body. If their foot is sticking out to the side like it is here, what we can do is we can put the operated limb against the wall and encourage them to sit, but because you're against the wall, you cannot kick that foot out. That'll increase range of motion in the knee. Starting at about 7 weeks after surgery, you want to increase their strength and their agility by encouraging them to walk in a figure 8 pattern. You can start this for 5 to 10 minutes, 2 to 3 times a day, and that will increase their strength during their last stages of their recovery.